When most people think of mesothelioma, they think of lung-related cancer. But about 20% of mesothelioma cases are peritoneal mesothelioma. It's the same cancer, but it affects the abdominal lining instead of the lung lining. Peritoneal mesothelioma is dramatically different in several important ways, from how exposure happens and how it's diagnosed to how it's treated, and most importantly, what the prognosis is. Today, I want to explain exactly how peritoneal mesothelioma differs from the pleural form of the disease. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I am not a physician, and this is not medical advice. But understanding these differences is critical if you or someone you love has been diagnosed with peritoneal mesothelioma. Let's start with where the cancer develops. While pleural mesothelioma develops in the pleura, which is the thin membrane lining the lungs and chest cavity, peritoneal mesothelioma develops in the peritoneum. That's the thin membrane lining the abdominal cavity and covering abdominal organs like the stomach, intestines, and liver. These are different locations entirely, though both do involve mesothelial tissue. The location difference drives everything else that's different about these diseases. How people are exposed to asbestos leading to peritoneal disease is much less clear than it is for pleural disease. For pleural mesothelioma, the pathway is straightforward. You breathe in asbestos fibers, they lodge in the cells of the pleura where they cause damage over decades, and the cancer begins to show symptoms. With peritoneal mesothelioma, researchers believe there are a few possible pathways. One theory is that asbestos fibers that are inhaled can migrate through the lymphatic system from the lungs to the abdomen. Another theory is that asbestos fibers can be swallowed in mucus from the lungs or in contaminated food or water and then penetrate through the digestive tract to reach the peritoneum. For women, specifically, there's evidence that talc contaminated with asbestos when used in genital areas can directly expose the peritoneum to asbestos. This is why we've seen peritoneal mesothelioma in women who use talcum powder for feminine hygiene. The bottom line is that we're less certain about the exact mechanisms of peritoneal exposure than we are about pleural exposure. But the clear connection to asbestos exists for both types. The symptoms of the two diseases are completely different. Pleural mesothelioma causes respiratory symptoms, shortness of breath, cough, chest pain, while peritoneal mesothelioma causes abdominal symptoms like abdominal swelling or distension from fluid accumulation called ascites, abdominal pain or discomfort, digestive issues like nausea, changes in bowel habits, unexplained weight loss, and feeling full quickly after eating. These symptoms are vague and easily attributed to other causes, which leads to one of the big challenges with peritoneal mesothelioma. Diagnosis is often delayed. Patients might be treated for irritable bowel syndrome or ovarian cysts or fibroids in women or other benign digestive issues for months before imaging reveals the real problem. Diagnosis approaches are different. For pleural disease, diagnosis typically starts with chest x-rays or CT scans. These can show pleural thickening or effusions, and then that's followed by biopsy, often through a thoracoscopy where a camera is inserted into the chest. But for peritoneal disease, diagnosis generally starts with a CT scan of the abdomen that shows peritoneal thickening, masses, or ascites, followed by biopsy, sometimes through paracentesis, where fluid is drawn from the abdomen, or through laparoscopy, where a camera is inserted into the abdominal cavity. Pathology is critical for both types to confirm mesothelioma and to determine cell type. Where peritoneal mesothelioma becomes dramatically different is in its treatment and its prognosis. While pleural mesothelioma treatment options include chemotherapy, immunotherapy, and sometimes surgery and offer a median survival typically between 12 and 18 months, even with treatment, some patients live longer with newer treatments. But for peritoneal mesothelioma, the standard of care when it's delivered at specialized centers is cytoreductive surgery combined with HIPEC, or heated intraperitoneal chemotherapy. This involves surgically removing all visible tumors from the abdominal cavity, which might include removing portions of the peritoneum, parts of the bowel, the spleen, or other affected areas, and then bathing the entire abdominal cavity with heated chemotherapy at about 108 degrees Fahrenheit for 90 to 120 minutes before closing the surgical site. This is a massive operation, often lasting 8 to 12 hours, but the results are remarkable. At experienced centers, median survival is 4 to 5 years. 5-year survival rates are 50 to 75%, and some patients are alive and disease-free 10 to 15 years later. Let me emphasize that difference. Pleural mesothelioma has a median survival of 12 to 18 months, while peritoneal mesothelioma, when treated with cytoreductive surgery and HIPEC at specialized centers, has a median survival of 4 to 5 years. That's 3 to 4 times longer. This dramatic difference means that peritoneal mesothelioma, while still very serious, is much less of an automatic death sentence than pleural disease. Some specialists even have been using the word curable in select peritoneal cases, though they do it cautiously. Now, I want to take a little break here for a second and ask you a favor. If you're finding this information helpful, please hit the like and subscribe buttons. It really helps us get seen by more people. If you have questions you'd like answered or a topic you'd like covered in a future video, send me a note in the comments section. And make sure you watch this video until the end, because I'm going to give you information about accessing help and valuable resources. Now, this is critical. The excellent outcomes I was just mentioning, they only occur at specialized centers with surgeons who are experienced in cytoreductive surgery and HIPEC. The procedure requires tremendous expertise. Complication rates are high if they're done at inexperienced centers. You absolutely must seek treatment at a center that performs dozens of these procedures per year. Remember that not every peritoneal patient is a candidate for cytoreductive surgery with HIPEC. Eligibility depends on whether the disease is confined to the abdominal cavity without spread to the distant organs, whether your overall health is good enough to tolerate a massive operation, whether complete or near complete removal of visible disease appears possible, and again, whether you're being evaluated at an experienced center. For patients who aren't surgical candidates, treatment options do exist. They include systemic chemotherapy, which is similar to what's used for pleural disease, or there are emerging immunotherapy approaches, though less data exists for using immunotherapy for peritoneal disease than is true of pleural mesothelioma. The cell type distribution is similar for both pleural and peritoneal disease. Epithelioid is the most common type and has the best prognosis. Sarcomatoid is most aggressive, and biphasic is in the middle. Recovery from cytoreductive surgery with HIPEC, it's significant. Patients typically spend a week to 10 days in the hospital, and full recovery takes several months. There's definitely a risk of complication, including infection, blood clots, or bowel complications. But for patients who successfully undergo this procedure and recover, the long-term outcomes can be excellent. Some peritoneal patients have been receiving additional treatment after surgery. One area of ongoing research is looking into a treatment called NIPEC, or normothermic intraperitoneal chemotherapy. This involves periodic chemotherapy infusions that are administered directly into the abdomen on an outpatient basis to prevent recurrence of the disease. Another difference between peritoneal and pleural mesothelioma is that peritoneal mesothelioma is diagnosed in women far more than pleural mesothelioma is. While overall mesothelioma is more common in men due to their higher occupational exposure, peritoneal disease shows a more balanced gender distribution than pleural, particularly in younger patients. There's a chance that this relates to the talc exposure pathway that affects women more than men. The latency period, which is the time from exposure to diagnosis, is similar for both types of the disease. It's typically 20 to 50 years with an average around 30 to 40 years. Legal and compensation considerations are also similar for peritoneal and pleural disease. Both types are caused by asbestos exposure and are eligible for the same types of legal claims and trust fund compensation. From a patient experience perspective, peritoneal disease is different in daily life. You're not dealing with breathing difficulties and respiratory symptoms. Instead, you're managing abdominal issues, discomfort, digestive problems, fluid accumulation. This affects different aspects of daily functioning. How is peritoneal mesothelioma different? It develops in the lining of the abdominal cavity and not the cavity holding the lungs. It causes abdominal symptoms rather than respiratory ones. It has a less clear exposure pathway, and most importantly, it has a dramatically better prognosis when treated with cytoreductive surgery and HIPEC at specialized centers. The median survival is 4 to 5 years versus 12 to 18 months for pleural disease. If you've been diagnosed with peritoneal mesothelioma, get evaluated at a specialized center that's experienced with this procedure. And visit mesothelioma.net for more information about peritoneal mesothelioma treatment centers as well as legal options. To speak directly with one of our patient advocates, call 1-800-692-8608 or use the live chat feature on our website. As for me, remember to post any questions you have below, and I'll see you next time.